Kumar Pandey. I am a practicing neurologist in Lucknow. I am at present associated with Integral Institute of Medical Sciences. And today I'm here about to talk about a topic which is epilepsy curable and what are the treatment options? Can one lead a normal life with it? So when we talk about the cure in epilepsy, typically we talk about control of seizures, which in most cases is achieved with medication. Epilepsy surgery can be very successful and may cure epilepsy in some people, but mostly the chunk of the epilepsy people are controlled with the drug therapy. How can we say that an epilepsy is cured or well controlled? So there is an aberrant definition is that if a patient is seizure free for 10 years and has not been on any drugs for last 5 years without having any seizures, then it can be considered that the epilepsy is been resolved in those patients. A person who has an age dependent epilepsy syndrome but who is now past the applicable age, they can also be considered to be resolved from epilepsy. Now, regarding treatment options, the number one and the foremost treatment option is the medication. There are over 2 dozens of medications which are available, and it has to be chosen by the doctor depending on what type of seizure you have, or what is your age, and what are the other medical conditions you are having, and what are the medications which is suitable for the type of epilepsy where which you are having. And now in females, there is a group of drugs which cannot be given. In pregnant females, there are a group of drugs which cannot be given. So these things should be taken in mind before prescribing. Now, when your doctor prescribes medication, they will choose one they feel is suitable for you, and not everyone with epilepsy will be on the same medication. So therefore, there are multiple number of drugs which can be given other than few. The medications which are used in the treatment of epilepsy are called anti-epileptic drugs. Up to 70% of the people with epilepsy have their seizure control with the epileptic drugs. Now, the second option is after medication is epilepsy surgery. Now, not all patients are advised for this. This is only taken in consideration when three of these conditions are met. Number one, when the anti-epileptic medication or the drugs which are used to control seizure are not working or they are not effectively controlling the seizure. Number two, seizures are disabling and impacting seriously on the quality of life. And number three, a surgical focus is identified, which is the cause of the epilepsy. So these are the things which can be considered for epileptic surgery. Now, after epileptic surgery, the next thing is the vagal nerve stimulation. Now, vagal nerve stimulation is a very less invasive procedure, and it is considered who are patient who are patients who are not controlled with medication alone, or they are not suitable for surgery, or who have failed surgery. So the aim of vagal nerve stimulation therapy is basically reduce the seizure frequency, and they can have the patient with less severe form of seizure. It is used together with medication. Normally, after the vagal nerve stimulation, the patient is also put on drugs. The VNS is a device powered by a battery, and it is placed under the skin of the chest on the left side, which with a wire is attached to the vagus nerve, which stimulates it and reducing the seizure frequency. Now, vagal nerve stimulation. Now, after that, one of the very emerging thing which is used from a long time is the ketogenic diet therapy. Now, in the patients where seizures are not controlled on medication, the surgery has been done or not been done, and vagal stimulation, those patients who are having refractory seizures can be put on ketogenic diet therapy. And it is an example where extremely low carbohydrate, high fat diet is used to treat epilepsy, which has not responded to other treatments. Now, the diet is specifically designed to force your body to burn fat instead of sugar for energy. This produces ketones, which gives the diet its name keto, that is ketogenic diet. It needs to be supervised by a neurologist and dietitian, and it should be integrated in the medical plan given to the patient, along with the medication which the patients are taking. It requires detailed medication and nutrition assessment to ensure that there is no underlying condition that would make the KTT trial dangerous. Now, the last question, which is a very good question, that can someone with epilepsy lead a normal life? Yes, the answer is yes, because most people with epilepsy can live a full and active life, working, playing sports, socializing, traveling, and taking up hobbies. Now, if seizure continues, some changes may be needed for safety reason, but it is still important to keep up a normal and a very healthy lifestyle as possible. So most of the patients with seizure, which are under good control with the drugs, they live a very normal life. They marry, they have kids, they do their studies, they do works. Few of the professions are advised to not choose some of the professions where you have to deal with heavy machinery and other things. But most of the patients who are under good control with seizure lead a very normal and healthy life, and they have a very prosperous married life with children, and they're happy, provided that the seizures are controlled well. So, thank you.